A positive HIV/AIDS test result means that you are infected with HIV/AIDS, human immunodeficiency virus, which causes infection AIDS, acquired immune deficiency syndrome. Contamination with HIV does not mean that you currently have AIDS. In any case, whenever left untreated, HIV contamination damages a person's unstoppable profile and can further AIDS. AIDS, acquired immune deficiency syndrome. AIDS full form. What is AIDS? HIV/AIDS help the most real stage of contamination. This results in the demolition of the insensitive structure of the contaminated person. Your insensitive structure is the resistance structure of your body. Cells in your immune system remove contamination and various infections. In the event that your resistance structure does not work adequately, you are at risk for real and dangerous pollution and fatal growth. HIV removes disease-fighting the cells of disagreement and insensitive structures, which protects the body against diseases and maladies. Which disease-fighting cells attack HIV? CD4 cells are a type of white platelet that fights diseases. HIV destroys these cells. They are similarly called CD4+ T cells or CD4 T lymphocytes. A CD4 tally is the amount of CD4 cells in an example of blood. The CD4 check shows us how well your resistive structure is working. When HIV enters a person's CD4 cells, it uses the cells to duplicate themselves. This process erases CD4 cells and reduces CD4 detection. As soon as you lose a CD4 cell, your protected structure becomes weak. A weak resistance structure makes it harder for your body to fight against illnesses and maladies. CD4 you must have as many cells as possible. In fact, this blood test can be requested even for individuals without HIV. I have lupus myself and we include this blood test to understand how good or ineffective my insensitive outline is. A typical range for CD4 cells is approximately 500–1500. How do I know if I have AIDS? Help is not a determination you can make yourself, it is analyzed when the secure framework is seriously debilitated. In the event that you are infected with HIV and your CD4 dips under 200 cells per cubic millimeter, or on the off chance that you create an AIDS symptomatic condition, a disease that occurs exceptionally in a person uncommon who do not suffer from HIV, you have AIDS. What are AIDS symptomatic conditions? What AIDS symptoms? In December 2002, the Centers for Disease Control and Prevention (CDC) expanded the most emitting and flow of AIDS symptomatic conditions. It can now include different diseases, yet these are the most widely recognized. The conditions for characterizing AIDS are candidiasis, cervical malfunction, objectionable, coccidioidomycosis, cryptococcus, cryptosporidiosis, cytomegalovirus sickness, encephalopathy, HIV-related, herpes simplex, extreme disease, histoplasmosis, Kaposi's sarcoma, lymphoma, special type, Mycobacterium avium complex, Pneumocystis carinii pneumonia (PCP), pneumonia, repeat, progressive multifocal leukoencephalopathy, Salmonella septicemia, repetitive, toxoplasmosis of the mind, tuberculosis, vein disorder. Individuals who do not have HIV can produce these diseases. This does not mean that he has AIDS. To be determined to have AIDS, a person must be contaminated with HIV. What is HIV treatment? AIDS treatment. AIDS HIV treatment is the use of drugs to keep a contaminated HIV solid. Treatment can help individuals in all stages of HIV infection. Although HIV can treat HIV disease against drugs, they cannot cure HIV contamination. HIV treatment is confusing and should be custom-tailored to you and your needs. Your contemplation, mixed drinks, may be completely different than a partner who is HIV positive. Some data about HIV/AIDS treatment right now. To begin the medication, what medications are used, how to find out if treatment is working, and what to do if your treatment is not working is done on a very singular basis. Talk with your human services supplier or unique transition specialist about your very situation. Your reflection mixture should probably be adjusted. Bolster assemblies, in the neighborhood and on the web, may be able to influence your irreversible infection supporters. Many find them valuable and encouraging. Remember that new drugs are constantly being conceived. Such important individuals can live long, full lives with HIV.